We see these characters in movies and on TV all the time, right? The unpredictable character, the master manipulator, the one who absolutely craves the spotlight. But what's the reality behind all these dramatic behaviors? Today, we're going to demystify a group of conditions known as Cluster B personality disorders and try to understand what really, truly defines them. So let's start with a little puzzle. I'm about to show you 4 very, very different behaviors. On the surface, they look like they have nothing in common. But as we go, see if you can spot the hidden thread that ties them all together. Just think about this for a second. On one hand, you've got someone who cons people for their own personal gain. Then, completely different, you have someone who's just terrified of being abandoned. Then there's the person who has to be the center of attention. And finally, someone with this unshakable belief that they're just plain superior to everyone else. So what could possibly connect these seemingly opposite traits? Well, here's the answer. That connecting thread is that they are all potential signs of what are called Cluster B personality disorders. This is basically a category of mental health conditions where the core features are things like emotional instability, impulsivity, and a really deep, persistent struggle with relationships. So here's our game plan. We'll dive into each of the 4 disorders in this cluster. That's antisocial, borderline, histrionic, and narcissistic. And then we'll wrap it all up by taking a look at how these are managed and what the overall outlook is. Ready? Let's get into it. All right, let's kick things off with antisocial personality disorder, or ASPD for short. Now, the key phrase you really want to lock in here is a persistent pattern of disregard for the rights of others. In fact, if you take away just one word for ASPD, make it this one: disregard. It's this fundamental lack of concern for social norms, for rules, and for the feelings or even the safety of other people. It's at the very heart of the disorder. And this core disregard, it shows up in a bunch of ways. You've got a disregard for the law, which can lead to illegal acts, a disregard for the truth, which you see in all the manipulation and lying, and a total disregard for consequences, which results in really impulsive, reckless behavior. And all of this happens without any real sense of guilt or remorse. So you might be wondering, where does something like this even come from? Well, it's almost never just one thing. It's better to think of it as a kind of perfect storm. It often starts with a genetic predisposition, maybe combined with some differences in brain function, especially around impulse control. Then you add in difficult childhood factors, like having a conduct disorder or experiencing abuse, and you can start to see how this pattern really takes hold. Okay, let's switch gears and move to our next disorder, borderline personality disorder, or BPD. Here, the central theme totally shifts. We're moving from disregard to a profound pattern of instability. And yep, if there's one word that defines BPD, it's instability. And we're not just talking about being a little moody. This is a deep, pervasive instability that affects pretty much everything: a person's relationships, their sense of who they even are, and their emotions from one day to the next. You can imagine how this instability creates a pretty turbulent inner world. A lot of it is driven by this really intense fear of abandonment. So, to avoid being left alone, a person might put someone up on a pedestal. That's what we call idealization. But then, the second they feel let down, that same person is completely devalued, torn down. This whole cycle is often paired with an unstable sense of self, impulsivity, and these chronic feelings of emptiness. But, and this is so important, there is a very hopeful note here. A specific type of therapy called dialectical behavior therapy, or DBT, was actually developed specifically for BPD, and today it's considered the absolute gold standard for treatment. It focuses on teaching practical skills to manage emotions, handle distress, and build better relationships. All right, on to our third disorder, histrionic personality disorder, or HPD. This one shifts the focus again. So if ASPD is about disregard and BPD is about instability, HPD is driven by something else entirely, this powerful, almost overwhelming need for attention. So let's just nail this down. ASPD is disregard, BPD is instability, and HPD is driven by a core of attention-seeking. The number one motivation behind the behaviors you see is to be noticed and to be the absolute center of everyone's focus. This need to be the focus means there's a real, genuine discomfort when they aren't. And this can lead to using their physical appearance to draw people in, expressing emotions in a really dramatic, over-the-top way, and often thinking that relationships are way more intimate than they actually are. And that brings us to our final disorder in the cluster, narcissistic personality disorder, or NPD.
Here, the defining traits are things like grandiosity, a constant need for admiration, and a profound lack of empathy for others.
Okay, this is a really, really crucial distinction to make because HPD and NPD get confused all the time. Think of it this way. For someone with HPD, any attention is good attention. But for someone with NPD, the motivation is way more specific. It's not just about being noticed, it's about being admired. Admired as someone who is special and superior.
At the absolute center of NPD is grandiosity. And this isn't just self-confidence. We're talking about an inflated, totally unrealistic sense of self-importance. It's this fundamental belief that they are special, unique, and just plain better than other people. And of course, this grandiosity needs constant fuel. That fuel comes from fantasies of unlimited success and power, from a constant demand for admiration, and from a lack of empathy that lets them exploit others to get what they want. All of it often wrapped up in this arrogant, dismissive attitude.
So, we've just walked through 4 pretty distinct disorders. Let's zoom out now and talk a little bit about how they're managed and what the general outlook is for people living with them.
When you look at treatment, a really clear pattern starts to emerge. For all 4 of these disorders, psychotherapy, talk therapy, is the main approach. And it's super important to understand that medication isn't used to cure the personality disorder itself. Instead, it's used to help manage specific, difficult symptoms, things like aggression, intense mood swings, or co-occurring depression. So at the end of the day, while each disorder has its own unique fingerprint, they all share these foundational challenges with emotional stability and with relationships. And that's exactly why a professional diagnosis isn't just helpful, it's absolutely essential for getting the right kind of tailored long-term therapy that can actually make a difference. And that right there is why having this kind of clinical understanding matters so much. When we move beyond the stereotypes and start seeing these as the serious, complex conditions they are, it helps reduce stigma. It really highlights the real suffering involved, and it underscores just how important it is to encourage people to seek out and receive appropriate, effective help.
So, we'll leave you with this final thought to chew on. We all have personality traits. Some of us are naturally more dramatic. Some of us might like a bit of attention. The critical question is, where is that line? Where does a simple trait end and a pervasive, inflexible, and distressing disorder begin? There is no easy answer, but exploring that question is really at the very heart of understanding human personality. Thanks for joining me.